At Unitron, we've had a long-standing loyalty program called Unite. Within the Unite program, there's a series of really exciting tools. Not only do we have the U-Link, which is the Unitron branded office management system that has EMR compatibility, we also have a very robust physician marketing program that allows you to talk with physicians and build relationships with them around the concept of disease state marketing. We have a series of clinical tools that you can use to leverage the concept of the shared decision-making process so that you're making your clinical experience far more engaging for the average patient. And then finally, we have this really exciting tool called the Unite Customizer that allows our Unitron representatives to visit your office and devise a individualized plan for how you might want to reinvest funds back into your business. There are three overarching trends that are affecting all of society and certainly affecting how hearing healthcare providers are going to be practicing in the very near future. The first trend is the creative destruction of healthcare. Because of the superconvergence of wireless sensors, low-cost computer power, social networking, and smartphones, we're going to see a real change in the way healthcare is delivered. The second trend is the healthy aging movement. People are not only living longer, but they're living and maintaining a healthier lifestyle, and that's certainly going to change the way that we interface with the market. The third trend is something we call the transparency of results. Everything that we do these days seems to be videotaped and available online. And what that really means to professionals is that there's always somebody looking over your shoulder and evaluating your work. And that has profound ways on the way that we're going to be practicing now and moving into the future. So one of the components of the path forward revolves around the shared decision-making process, where the physician or where the audiologist or the hearing care provider interfaces and interacts on a one-to-one basis with each individual, and they share in the entire decision-making process in a more collaborative manner. With all the low-cost computer power that's now available, you can tailor your office in a very specific way using your office management system. You can not only bill and schedule now in a more precise manner, but you can also reach out to your database and have a virtual conversation using social media, using newsletters, and other traditional forms of advertising to have a two-way dialogue with a segmented portion of your database every month. In addition to that, with using real-time data, you can collect a lot of metrics that help you manage your office more efficiently. For example, you can collect real-time data around how much you're charging for specific services, what the reimbursement rates are. You can look at that in real time and see how you might want to tweak your office, change the design, change the workflow to create more efficiency and ultimately generate more revenue while at the same time increasing patient satisfaction for the individual patients that you see. Another aspect of customizing a practice revolves around marketing and how you attract patients to your office. And there's a lot of really interesting and exciting changes happening within healthcare. We're moving from a procedure-based model to a preventive model. And I think there's some real opportunities for hearing care providers to foster relationships with physicians where they become the trusted advisor when it comes to providing preventive care to patients. We call that comorbidity or disease state marketing. And the basic concept is there are many conditions like diabetes, dementia, cardiovascular disease that have a high rate of hearing loss. And audiologists and hearing care professionals have a real opportunity to educate the physician community about that relationship and how their expertise can prevent some of those problems from worsening through screening and through the promotion of better hearing at an earlier age. So as I hope you can see, there's a lot of really exciting things happening not only within the industry, but also within our Unite program. We think there's a real opportunity for practitioners to update and change their strategy as far as how they attract patients to their office and how they run and manage their business. And it's really easy to get started in the program. All you have to do is give your Unitron representative a call, or you can give me a call, and we can schedule a time to get started.